Welcome to RAAONLINE, and today's topic is about local anesthetics. So when we go for local anesthetics and in a particular part of our body, if we have to do any surgical intervention or any suture removal or any some treatment in a particular part of body and where we need there is no loss of consciousness is needed, we go for this local anesthetics. So in this PowerPoint, we are going to see what are the types of local anesthetics and what are the techniques we use with local anesthetics and its advantages as well as about its disadvantages. A 58-year-old man is scheduled for elective herniopathy. So which group of anesthesia you choose and justify the anesthetic agents used for this patient. And with the anesthesia, we used to combine a vasoconstrictor. If it is a local anesthesia, we used to combine a vasoconstrictor, commonly adrenaline. Why? What is the rationale for combining that? And what are the complications arise with the local anesthesia? So these are the things we are going to see in this PowerPoint. So the classification of local anesthetics, its mechanism of action, pharmacological actions, techniques used, addition of a vasoconstrictor, and about it adverse effects, disadvantages of local anesthetics. These things we are going to discuss in this PowerPoint. The first thing, what is local anesthetic? A local anesthetic is an agent which upon local application or local injection produces reversible loss of sensory perception, especially pain, in a specific region of the body. That is, the important things we have to remember is, it won't produce us loss of consciousness, it won't produce any structural damage to the neurons, and it is used only in specific areas, and loss of sensory as well as motor impulses takes place with the local anesthesia. So reversible loss of sensation in a particular part of body without affecting the consciousness is produced by this local anesthetics. History of local anesthetics. Cocaine is the first local anesthetic which was found in 19th century, and all other local anesthetics, they produces depression of respiration as well as depression of central nervous system. This cocaine is the exception which produces stimulation of central nervous system and local anesthetic action. That is, after the cocaine was found in 1860, in 1905, procaine was the drug found by Enhan, and 1943, the lignocaine, the boon of the drug, which drug what we are using till now is found in 1943 by Lofgren. What is the difference between LA and GA? LA produces local action. GA produces the action in the central nervous system that involves central nervous system, and limited part of a body in a specific organ or in the specific part of the body, the local anesthesia produces the effect. Difference between LA as well as GA. Local anesthetics, they produces action in a specific organ or local part of the body. At the same time, general anesthetics, they involve central nervous system and they produces action throughout our body. And there won't be any loss of consciousness with LA, and loss of consciousness, especially reversible loss of consciousness, is a major thing which occurs with GA. And vital parameter monitoring is not required for local anesthetics. It is considered to be safe. At the same time, GA involves with the central nervous system as well as respiratory system, cardiovascular system. Vital parameter monitoring is must for general anesthetics. So general anesthesia sedates the entire body, loss of consciousness occurs, and mainly acts through calcium block as well as transmitter release. General anesthetics acts by NMDA as well as GABA receptors. But this local anesthetics, they acts on the localized area, no effect in the consciousness. They mainly blocks the sodium channels, conductional or axonal sodium entry. So mainly they block the sodium channels and the impulse conduction is blocked by this local anesthetics. All these local anesthetics have this aromatic part as well as the lipohydrophilic, otherwise called as aliphatic part. Aromatic as well as aliphatic part. Lipophilic as well as hydrophilic part. This is combined by, this aromatic as well as aliphatic part is combined by either esters or amide. So accordingly, the local anesthetics are classified. Ester linked local anesthetics or amide linked local anesthetics. Every local anesthetics will have both the part, and this is combined by either by ester or by amide. The difference between ester linked as well as amide linked local anesthetics. In this ester linked local anesthetics, therapeutically, according to pharmacologically, they are mainly short acting, but this amide linked, they are long acting and intense LA action is produced. Hypersensitivity reaction is more with ester linked and it is less with amide linked. They mainly act through alpha-1 acid glycoprotein. This is a type of plasma protein which is present in our body, which involves plasma protein binding. But these amide linked drugs, they binds with this alpha-1 acid glycoprotein. And this is hydrolyzed by plasma esterases, and these amide linked drugs are metabolized in the liver. So this is the difference between ester linked and amide linked. And for your remembrance, you can remember this amide linked or amide type of local anesthetics, they will have two eyes. They are longer acting, and they mostly in their name they will have two eye in their spellings. Bupivacaine, ropivacaine, dibucaine. So these type of drugs. Lidocaine, mepivacaine, prilocaine, like that, two eye will be there in their spelling. In the ester type, they will have only one eye in their spelling. Tetracaine, cocaine, procaine, like chlorprocaine, that only one eye will be in the spelling for our